Hello, everyone. This is Stephanie with Healthcare-Edu, and we are going to go over some of the items that you bring in the room to do certain skills. So I'm actually going to share my screen, and we're talking about the Prometrics checklist for the state exam, the CNA Certified Nursing Assistant state exam in the state of Massachusetts. And so let's get started, okay? And my students really asked me to do these videos, so I am posting them up here for you. Okay, so you should be able to see my screen. This is the Prometrics Clinical Skills Test Checklist. This is what I have students bring when they do the labs. And actually, let me turn my little spotlight on. And so what we're going to do, these videos are posted so you can watch me do the videos. But right now, I'm going to talk about the items you bring in for every skill and also kind of some things to pay attention to. So let's start right off the top here. Page 2, you have ambulate the resident using a transfer gait belt. Okay, so this is the one that we're talking about now. Now, what people don't understand, this is a checklist for the evaluator to kind of just say, did the candidate, the person taking the test, do these things? So of course, did they present their name? And I'll have a video about the intro and outro you do for every skill, okay? So really what you wanna bring in for these items, I'll repeat it twice, you wanna jot it down. You bring in non-skid socks for safety. You bring in a robe, and so I end up bringing in a Johnny, using it as a robe, and you bring in the transfer gait belts, okay? So check out my video about how you position your hands. But a couple of things I want to point out, you want to, when they sit on the side of the bed, you want to make sure that they dangle, okay? They have to plant their feet on the ground, and they have to sit there for 2 to 3 minutes while you put on the robe, and you ask them if they are dizzy, do they feel dizzy or lightheadedness? This is called dangling. And the reason you do that is that you want to prevent orthostatic hypotension, meaning when a person goes from lying to sitting, their blood pressure drops and they could fall. So that's a very important safety step. You do that. And right here, usually this provides signal or cue to the resident. When you look at my video, I usually say on the count of 3, push up with both hands. And so that's the signal or cue, okay? And so they know when to stand. So we have that, and there's nothing else. This is really straightforward. A couple of sentences that I say when you watch the video, and I'll say it here. So they get up, they start walking towards the chair, and it talks to you about, let me move this. It mentions that they have to walk at least 10 steps, right? Where you see my cursor there, they have to walk at least 10 steps. Halfway through, I make sure that I ask them if they feel dizzy or lightheadedness again. And then these are the sentences that I say when they get to the chair. When they get to their chair and they turn around and they start walking backwards, I say, keep walking until you feel the chair with the back of your legs. This guarantees that they're far enough into the chair that they'll sit correctly. Then afterwards, I say, reach back with both of your arms and hold on to the armrest. This actually guarantees that what they're about to sit on is secure and is not going to move. And then you tell them on the count of 3, I'm going to squat down and lower you, and for you to sit in the chair. So 1, 2, 3, and then you lower them. So again, you could watch the video, but if you take those tips, you'll be able to maintain your own body mechanic like it says here. You'll be able to sit them, position them correctly, all right, and be able to be successful with this skill. So I hope that helps. Thank you.